Hi, everyone. Thank you so much for joining us today. My name is Sally Smolinski. I am on the provider network team here at OCHN. Just a few things as reminders. If you could please mute yourselves. And if you are using a telephone device to call in and you would like to unmute yourself for a question, it's *6 to unmute yourself. Otherwise, it's just that little microphone looking button on your screen. Also, you'll see a function with a hand up, and that would just mean that you can click that if you have a question, or you can utilize the chat for any questions, and I'll just kind of be monitoring that as we go. And Tracy can field questions as we go, and I'm sure there'll be time at the end to field some questions as well. So we're going to go ahead and get started. This training today is just to give you an overview of the SSI SSDI eligibility and work incentives that allow individuals to increase their income through employment while maintaining health insurance benefits. And I'll let Tracy go a little bit more thoroughly into the learning objectives of today. Tracy Howard is the Benefit to Work Coach State Lead and has worked at Training and Treatment Innovations for over a decade. She has been providing a variety of services related to public benefits and Social Security work incentives, including individualized benefits counseling, presentations, and trainings. So with that, I will turn it over to Tracy.
Thanks, Sally. I'm glad everyone could join us today, and I know this is a completely different and new way for all of us to be connected, so I'm glad all of you made it here on this platform. And like Sally said, this is not meant to be a presentation where I'm just talking at you for 2 hours. When you have questions, please use the chat feature or the raise hand feature. There'll be times where I'll pause and ask for questions as well too. My goal in this is helping you guys understand the basic, like Sally said, the basic eligibility for SSI and SSDI and the basic work incentives related to both of those programs. There's unfortunately so many myths out there related to Social Security and work, and oftentimes individuals fear that by going to work that's going to represent a loss of something for them, and that's couldn't be more inaccurate. So by doing presentations like this and by answering your questions, hopefully you can understand the reality of the situation. And we have a variety of different people attending, so for either yourselves or your family members, or for the folks that you're providing services to be able to best defeat those myths as we go. So, and like Sally said, I've been with Training and Treatment Innovations for over 11 years now, actually. And that's one of the core providers here in Oakland County and doing all benefit related stuff. And then most recently, the last couple of years, I've been working under a contract through the state to start an initiative, what's called the Benefit to Work Coach, which is like a mid-level practitioner for training individuals within the community mental health system to have a basic understanding of the work incentives, how folks' benefits are going to be affected by work, and provide accurate advisement in order to continue to promote employment and not have the fear of loss of benefits stopping people from gaining employment. I often get teased by my coworkers, you know, when they come and ask me questions and I might know the answer, and they say, how do you do this all day long? How can you stand this kind of work? Well, my brain likes this, and I'm a little strange that way, but I also really understand that it's not just about the rules, and it's not just about the regulations and trying to navigate all that. It's really, how does this impact somebody's life? You know, when somebody applies for a Social Security disability benefit, usually that's not a real great place for them. You know, they're at the point where looking at a disabling condition that's expected to last at least 12 months. Maybe some folks have been working prior, maybe some folks haven't, but you know, it kind of takes for folks a lot of kind of swallowing their pride a little bit sometimes to apply for that disability benefit, because we as humans always want to put our best foot forward and say that things are okay. And so when folks apply for that disability benefit, generally they've hit a point where they realize they really need some extra help. And a lot of times folks look at that as a life sentence, so to speak, and it's really not. And hopefully as we go through this today, you can understand that how folks become eligible for the two Social Security disability benefits, the difference between them, that it is possible to work while they're on benefits to get ahead financially, to keep access to the benefits or keep the cash benefit, keep health insurance, and improve their life over time. But what these benefits do is give folks a base of stability in order to then work on other goals. So when folks are at a place where, when they're in the application process, they're often maybe don't have stable housing, maybe don't have consistent access to health care and treatment and medications that they need. So there's a lot of instability. So when folks are approved for these benefits, they provide that base. And then having that base of stability helps folks then move on to be able to work on greater goals. And work is one of those things. So my role whenever I'm meeting with folks is always to say to not let the fear of loss of benefits be a barrier to you working and you improving your life. So that's kind of my background. What we're going to cover today is kind of looking at some of the myths and then looking at the facts behind that. Basically, hopefully by the end of today, I want you to come away with at least a couple of concepts and be able to defeat those myths, so that understanding that work incentives are rules to help people support them in working and maintaining access to their benefits, so that they can maintain access to their health insurance, both Medicare and Medicaid. They can keep their cash benefit or access to their cash benefit. They can keep their eligibility status with the SSI or SSDI benefit while they're earning income. And they can access funding to pay for work expenses as well too. So there's a lot of provisions that Social Security provides for individuals to test out working and not fear the loss of benefits. There's a lot of safety nets that are provided. Unfortunately, a lot of folks think, more in black and white terms of, there's a specific number of hours or a specific dollar value that a person can earn. And that's not the case with either program. So as we go through things today, hopefully you'll get a clearer understanding of that. So what we're going to cover is the basic eligibility rules for SSDI and Medicare, and the work rules associated with those, and the basic SSI eligibility and Medicaid eligibility and the work rules related to that. I used to not include freedom to work Medicaid, but I've gotten so many questions when I do presentations around that, so I am including that now because it is a great work incentive to really help people maintain their health insurance while working. So we'll talk about that. And then where do you go from today? Where can you get more help? What are additional resources? How can you, if you yourself are receiving a disability benefit, get additional assistance with navigating this path to employment? If you're working with folks who are receiving a Social Security benefit, how can you help them get more connected? If you're a family member or a support person to somebody who's receiving this, how can you help them get connected as well too? So we'll cover where folks can get more help in those resources. So we're going to start with SSI and Medicaid. Any questions up to this point before we dive in?
There is a question presented. Sorry. Why does Freedom to Work have a fee to be enrolled in the program? I received a bill every month for that.
When we get to the Freedom to Work section, I will go into that for you. And I'll explain kind of where that came from and how that's calculated. So sometimes if you ask a question, it is something that we're going to get to at the end. I'll just pause that and Sally, if you could remind me if I don't answer that question, or whoever asked that question, if you have more questions after we go through it, let me know then.
Sure.
Thanks. Alrighty, so there's as I talked about, there's two basic Social Security disability benefits. There's SSI. SSI is Supplemental Security Income, and it's a needs-based program. And the other one that we're going to go through after we go through SSI is SSDI, which is Social Security Disability Insurance. There are a couple other variant programs under the SSDI umbrella. One is called Childhood Disability Benefits, that is where if an individual meets the criteria for that program, they're able to pull that disability benefit off of a parent's work record. And another program that allows a disabled widower or widow to collect off of a spouse's work record. But no, under those categories that we don't see quite as often, that those work rules follow the SSDI work rules. But first, we're going to talk about SSI, because a lot of times folks use SSI and SSDI terms interchangeably. So they say they're getting one benefit and they're actually getting the other, or vice versa. Or there's questions of like, why does my friend over here get $1,200 and I only get $783? So what's the difference between those benefits? So having a basic understanding of the difference between the two benefits and what the eligibility criteria helps to address some of those questions. So I'm going to show you a short video on what is SSI and the eligibility criteria for this. And this video and lots of others can be found on the Michigan Disability Benefits 101 site, which I'm going to show you as a resource at the end.
What is SSI? A Griffin Hammes production, tailored for Michigan. I'm really confused about this SSI thing. It's a bit of a mystery to me. Well, we can easily clear that up. SSI stands for Supplemental Security Income. It's a program that's run by Social Security. If you're eligible for SSI, Social Security gives you money each month to help you pay for things like food, rent, and utilities. Most people who get SSI also get a low-cost health insurance called Medicaid. Oh, so that's what SSI is. Well, who can get it? Great question. If you have a disability, you may be able to get SSI. To be eligible, you must also have low assets and low income. I do have a disability, and I don't have very much money. Well, you may already be receiving SSI, and if not, you may be eligible. Let's look at the 3 requirements one at a time. First, you have to meet Social Security's definition of disability. Now, they have some pretty specific rules for this, like your disability must be severe, long-term, and limit your ability to work. If you're under 18, rather than looking at work, Social Security looks at how your disability limits daily activities. I'm pretty sure I meet their definition of disability. Great. Let's look at the second requirement. Your assets must be below $2,000 or below $3,000 if you're married. What are assets? Assets are the things you own, like a house, a bank account, or a car. But not all your assets count. For example, if you own the house you live in, it won't count. And a car you use for transportation won't count either. If you're under 18, some of your parents' assets may count. Okay, I think I've got it so far. So what's the third requirement? The third requirement is that your monthly income must be below $783, or below $1,175 if you're married. Well, what exactly is income? Income is money you receive, like a paycheck from work or a Social Security disability benefit. But not all your income counts. For example, if you have wages, Social Security only counts about half of it. And if you have unearned income, like a Social Security disability benefit, they don't count $20 of it. After the deductions, if your income is below the limit of $783 or $1,175, you may be eligible for some SSI. If you're under 18, some of your parents' income may count. All right. Now that I know what the 3 requirements are, how can I find out if I'm already getting SSI? It's easy. Just call Social Security at 1-800-772-1213 and ask. Their TTY number is 1-800-325-0778. You can also go online to ssa.gov/sign-in. After you create an account and log in, under the Overview tab in the Benefits and Payments section, it tells you if you get SSI. Great, I'll totally check that out. If I'm not getting SSI, how do I apply? You can apply for SSI at Social Security office or by calling 1-800-772-1213. Awesome. Now I understand what SSI is and who can get it. I'm glad we solved this mystery for you. You can learn even more about SSI on mi.db101.org. Read the SSI articles about eligibility and application, or use the tool called Your SSI Benefit Calculation to estimate if your income is low enough. To see more videos like this one, go to mi.db101.org/video/benefits. Knowledge is power. Take time to learn more about SSI. What is
Alrighty. So basics to SSI is it's a needs-based program. So somebody to be eligible for SSI has to meet the income and asset eligibility to be eligible for that. So they have to be disabled according to the Social Security definition, which the video went into a little bit. And basic understanding is that the disability has to be expected to last at least 12 months or expected to result in death. It has to be impairing an individual's activities of daily living and ultimately their ability to work. There is also an age-based SSI category for folks who are over 65, just to kind of as a side note. Because it's a needs-based program, also have to have assets below $2,000. So that's cash assets, so money in the bank, money in on hand, not generally the items that you possess. And first place that an individual lives, their first home and first car, generally don't count as assets either. But anything that can be converted to a cash asset, so generally retirement accounts can count, investments, that kind of stuff. And then income has to be below the countable income has to be below this year $783 a month. And countable income, like the video talked a little bit about, is not all of a person's income. If they have any unearned income, so if they're receiving an SSDI benefit, if they're receiving a pension or retirement benefit from work, unemployment is an unearned income, you take $20 off of that, and then it counts half of an individual's earnings. So if between the two of those, after they take off the deductions, the amount is greater than $783, then somebody wouldn't be eligible for SSI. And this year, the maximum benefit for an individual who's living independently is $783. That amount generally goes up a little bit every year, but you can tell by $783 that a person certainly is not, living large with that amount of money. So certainly work is a way for an individual to help themselves get out of an impoverished situation. And then the other piece related to how much a person is eligible for in that benefit is if an individual is not contributing what Social Security deems as their fair share for their food and shelter expenses, then the amount of their benefit can be reduced, and that's generally reduced by 1/3. So for instance, if an individual is living with their parents and not paying any rent, then the amount that the most that they can be eligible for in an SSI benefit is reduced by 1/3. If an individual is living with their parent and they are paying rent and it is considered their fair share, an equitable amount for what they're where they're living and what the value of the home is, as far as like what it costs for the home, then they would be eligible for the full amount. And then I put in here, when is this benefit paid? And the reason I do that is one way to really differentiate whether an individual is receiving an SSI benefit or an SSDI benefit. So the SSI benefit is always paid on the first of the month. And then SSI in Michigan automatically comes with Medicaid. So there's no separate determination needed to see if an individual is eligible for Medicaid. So if an individual receives SSI, even $1 in SSI, then they are eligible for Medicaid in Michigan. It's an automatic thing. And then, as the video said as well too, if somebody is under 18, then the parents' income and assets would be counted in that formula as to whether they meet that need-based criteria. And if an individual is married, same thing, part of the spouse's income and assets would be counted in that formula. Basic eligibility requirements around SSI, needs-based program, and have to meet the income and asset pieces on that. Any questions on that before we move into the work incentives on SSI? Alrighty.
Not seeing any in chat.
Okay, thanks, Sally. So here's 2 common myths that go along with SSI. So myth is that my SSI goes down when I work, so I end up losing money. It is true that when an individual works, that their SSI amount is reduced, but it is not mathematically possible for an individual to end up with less money by working under SSI, and we'll show you how that's possible in just a minute. And then the other one is if I earn so much that my SSI benefit goes to 0, that I'm going to lose my Medicaid, I'm going to lose the SSI, and I'm going to have a really hard time getting it back. And that's not true whatsoever either. So I'm going to go through another video, same drill. It's on the Michigan Disability Benefits 101 site. And the reason I'm showing these videos is for a couple of different reasons. One, they're done in very plain English, easily understandable. You can, if you're working with someone or want to explain somebody what the eligibility criteria is and what the work incentives are, instead of trying to remember all those rules, you can pull up a video and say, hey, let me show you a quick little snippet to give you an overview of what the eligibility is and what the work rules are. So not only for your benefit in learning today, but also to share with others. So here are the basic work incentives related to SSI and Medicaid.
Supplemental Security Income and Work, a Griffin Hammis production tailored for Michigan. Do you receive SSI? Have you ever wondered, what would happen if I work? Well, I'm here to tell you there are 3 great things that can happen when you work. 1, you'll have more money. 2, you can stay connected to SSI. And 3, you can keep Medicaid. That's a good deal. It means if you go to work, you can get ahead and keep the safety nets you need. Now, there's a lot of confusion out there about SSI and work. So let's get the facts straight. SSI fact number 1. If you work, you'll have more money. Really? How's that possible? Let's say you land a job making $1,200 a month. That sounds great. Can you guess how much your SSI would be? I'm guessing it would be 0. Actually, it's possible you could still receive some SSI. You see, when figuring out your benefit amount, Social Security reduces your SSI by about half of whatever your wages are. If you started with $783 of SSI, in this example, it would likely reduce to $225. So you'd have $1,200 of wages plus $225 of SSI for a total of $1,425 a month. Wow, I thought I'd have less money if I worked. Nope, by working and earning this amount, you'll almost double your monthly income. Pretty cool, huh? Yeah, that's great. SSI fact number 2. You can stay connected to SSI when you work. Let's say you get a really great job making $1,800 a month. Cool. When you earn this amount, your SSI would be $0, but you'd still have $1,800 in wages, so you'd be getting ahead. Well, I like the idea of having $1,800, but what if I lost my job? Then what? That's exactly what this is about. If earnings make your SSI drop to $0, you can keep SSI eligibility status. This is a safety net that keeps you connected to the system. So if you lose your job, you can just tell Social Security and they can quickly restart your SSI. Wow, that's great. You're right. And the name of this great safety net is 1619B. SSI fact number 3. You can keep Medicaid when you work. Many people with disabilities rely on Medicaid for important services. Yeah, I'm one of those people. I use it for going to see my doctor and medications. Well, I've got great news. Because you get SSI, there are ways you can keep Medicaid when you work. Really? How's that possible? Well, if you continue getting some SSI when you work, you'll simply keep Medicaid because your income will be low enough. And if you work so much that your SSI is 0, you can still use the 1619B safety net we just talked about to keep Medicaid. That's fantastic. To use 1619B, you need to follow all the SSI eligibility rules. But in Michigan, you can earn around $36,000 a year. Wow, that's incredible. So, the moral to this story is, by working, you can have more money, stay connected to SSI, maintain your Medicaid, and have a better quality of life. With SSI, it pays to work. Now, there are ways you can learn more about all of this on mi.db101.org. For example, you could read the SSI and Work article, or use the tool called Your SSI Benefit Calculation to see what happens when you earn different amounts. And if you'd like to talk to someone about how you can be better off with a job, call Social Security's Ticket to Work helpline at 1-866-968-7842. Their TTY number is 1-866-833-2967. To see more videos like this one, go to mi.db101.org/video/benefits. Knowledge is power. Take time to learn more about SSI and work.
Alrighty. So, fact number 1. So our myth was that we were going to have less money if we went to work with SSI. So fact number 1, with SSI and wages, you have more money. So how that's possible, the video showed it a little bit. So for about every $2 that an individual earns, that SSI is reduced by $1. So it is not reduced dollar for dollar. So therefore, even though that SSI check is going down, an individual is going to end up with more money overall. I put on this slide a little example of how that payment is calculated, and I understand most people don't like math, but just to kind of have it sink in a little bit. So right now, if an individual is not working and living independently, they're receiving $783 a month. In the example here, if somebody goes to work and starts earning $1,200 a month in wages, that's going to make their new SSI payment $225.50, and these next 2 bullet points is just how that's calculated. You take the $1,200 in gross wages, there's a $20 general income exclusion, a $65 earned income exclusion, subtract those and then divide by 2. So out of the $1,200 that the individual earns, Social Security is only counting $557.50 of that against their SSI check. So you take that 783 minus the 557. I didn't update that second number. I apologize. It is 225.50. So what that means is somebody's getting 225.50 in SSI plus the $1,200 in wages. So their total income is $1,425 a month. So they've almost doubled their income by going to work. So they do not end up with less money by working, which is phenomenal. That myth was my SSI was going to go down if I go to work and I end up losing money. So even though that SSI check is being reduced, still coming out way ahead financially. And as the video said, there is a tool on the Disability Benefits 101 site that allows, very easy because people don't like math, to be able to show, do that calculation really easy. I'm just going to bring that up real quick. Alrighty, make that a little bit bigger. So on the Disability Benefits 101 site, there's this tool called your SSI benefit calculation. So all you would have to do is if the person has any unearned income, you would pop that in. If not, you're just typing in what their gross wages are per month, and then it's automatically doing that math for you. So $1,200 in gross monthly income calculates that countable income is $557.50. This step is if the person had unearned income in addition. It's just adding those two together and then subtracting to find out how much that new SSI amount would be. So in our scenario, again, it's that $225.50, and total monthly income is that $1,425. So I use this tool when I'm showing folks how their benefits would be affected when folks are maybe starting to work and maybe considering working another job or considering increasing their hours. We can look at what that would look like financially real quick without having to get pen, paper, and calculator out. So this is on the Disability Benefits 101 site. It is within the SSI and the SSI article, just to give you an overview of where that's at. When you go to the Disability Benefits 101 site, it looks like this. And if you go to the SSI article, SSI and Work, you'll find it right there. So it'll show you that calculator right there. The Disability Benefits 101 site is a great tool and resource for folks. It has tons of information. It houses all those videos, and there's these quick tools like I just showed you, and there's also estimators which go into a person's situation in much more detail and looks at not just their Social Security benefits, but other benefits as well too. So Medicare, Medicaid, food assistance, housing, all those kinds of things. Any questions on this first part of the SSI, on just that calculation?
Just as a friendly reminder, you'll have to unmute yourselves in order to ask the question audibly, and then also you can use the chat feature. All right, I'm not seeing any.
Okay, move on. All right, so the next myth that we talked about was if earnings make SSI go to zero, I lose Medicaid and I can't get my SSI back. So the fact of that is, as the video showed, is that my SSI, if I earn so much that it zeroes out my SSI payment, that does not mean that my SSI claim is closed. It actually keeps it open. It allows me to keep Medicaid and allows me to restart my SSI very quickly if my earnings either drop to the point where I'm eligible for a check again, or if I have to stop working completely. And that's that 1619B provision. So basically what that 1619B provision is, allows an individual to keep that SSI claim open and to keep Medicaid if their SSI payment goes to zero. So this year that amount is $36,887. So that means an individual, if they're earning so much that their SSI check goes to zero and it's below that $36,887, then Medicaid's going to stay in place, which is huge, because a lot of times folks understand that they can get ahead financially while working with SSI, and even if they earn more to the point where they're not eligible for an SSI payment, they're still getting ahead financially. They understand that, but they're afraid of losing Medicaid. The 1619B provision allows, provides for that Medicaid to stay in place. Earnings up to $36,887, which is a phenomenal work incentive for folks to be able to keep Medicaid. So they have to continue to have a disability, so they can't have been found medically improved. Assets while they're working still have to stay below that $2,000 mark. There's the provision of need Medicaid, and that's met very easily. It's either have they used their Medicaid coverage at least once in the last year, or do they intend to use it at least once in the upcoming year. So it's a very easy standard to meet. And that they would be eligible for SSI if they had no earnings. So basically it's saying I'm eligible for SSI in every other way except my earnings are too high. So that's a huge incentive for folks to be able to work and maintain that Medicaid coverage and keep that SSI claim open. When I was first learning this stuff, I had a really hard time with believing that there wasn't some end point when that SSI claim would stay closed, and I finally accepted it. As long as you're still eligible, as the slide indicates, for SSI in every other way except your earnings, that SSI claim stays open. So that means if an individual works, for the next 5 years, maintains eligibility in every other way, just not eligible for an SSI payment, and then they're unable to maintain working, that SSI claim is open, they report that their earnings dropped, they stopped working to Social Security, SSI payments start back up again. So they don't have to reapply. And when folks think about the loss of a Social Security benefit, they think about the time generally when they were applying. And most individuals in the application process, it's not a short process. It's usually waiting at least 6 months for the initial decision when folks apply for a Social Security benefit. If they're denied at that initial decision, then they're waiting usually around a year or more for a hearing. So folks oftentimes have been waiting a year and a half or longer to be approved for that benefit. So when they think about work, unfortunately, they buy into some of those myths, and they think that, I'm going to have to, if I lose that SSI, I'm going to have to go back to that place of waiting so long to get that benefit that's helped keep me stable and helped give me that base of stability. So keep that in mind, as you're thinking about that this really creates that base of stability, but these work incentives keeps that base in place and allows folks to get ahead financially and keep their health insurance and continue to find improvement in their lives. Any questions on anything SSI related? And feel free to either type it in the chat box or unmute yourself and speak out loud.
It looks like we have a hand up. Let me see if I can figure out who it is.
If you put your hand up, just go ahead and unmute yourself and go ahead and ask your question.
Yeah, it disappeared now. If someone had their hand up, if you could. Megan, was that you? I see she's unmuted. I'm not hearing anyone though.
Okay. So that's the basic eligibility and work rules around SSI and Medicaid. So now we're going to jump into the SSDI and Medicare. So SSDI comes with Medicare, just like SSI comes with Medicaid. So again, kind of same format as we did under the SSI. I'm going to go through the basic eligibility criteria for SSDI. So you have an understanding of why somebody might be eligible for one benefit versus the other benefit. So another quick video on the eligibility criteria for SSDI.
Tracy, is there sound?
I know why. Sorry, I need to go back and reshare. I realized I needed to hit that every time. Apologize for that. Thanks for letting me know.
No problem.
All right, let's try this again.
Production tailored for Michigan.
Here now?
Have you been wondering
I can hear it now.
SSDI or who can get it? Well, we can clear that up for you. SSDI stands for Social Security Disability Insurance. It's a monthly cash benefit for some people with disabilities. After you've been eligible for SSDI for 24 months, you'll also get a health insurance called Medicare. Oh, that's great. Well, who can get SSDI? Well, there are 2 rules you'll have to meet to get SSDI. The first one is you have to meet Social Security's definition of disability. They have some pretty specific rules for this, like your disability must be severe, long-term, and limit your ability to work. Oh, okay. Well, I'm pretty sure I meet that definition of disability. Okay. Let's look at the second rule. To get SSDI, you must have worked enough to reach Disability Insured status. What does that mean? Well, when you work, your employer takes a little bit of your wages, matches it dollar for dollar, and then pays all of that into the Social Security Trust Fund for you. Once you've paid enough into the trust fund, you can be considered insured. How can I figure out if I have this insured status? You can call Social Security at 1-800-772-1213 and ask. Their TTY number is 1-800-325-0778. You can also go online to ssa.gov/sign-in. After you create an account and log in under the Estimated Benefits tab, it tells you if you've reached disability insured status. That's great. I'll check it out. So how much money will I get each month with SSDI? Great question. The amount you get is based on how much you paid in to the Social Security Trust Fund. For example, someone who earned $70,000 a year for many years may get around $2,000 a month in SSDI, and someone who earned $5,000 a year for many years may get around $400 a month in SSDI. If I'm not getting SSDI, how do I apply? You can apply by calling Social Security at 1-800-772-1213, by going to a Social Security office, or online at ssa.gov. This is great. I finally understand what SSDI is and who can get it. Well, I'm glad we cleared that up for you. You can also learn even more about SSDI eligibility and the application process on mi.db101.org. And to see more videos like this one, go to mi.db101.org/video/benefits. Knowledge is power. Take time to learn more about SSDI.
Alrighty, so basic eligibility criteria for SSDI. So again, SSDI stands for Social Security Disability Insurance, and I always accent that insurance piece. So when you have an insurance benefit, you had to do something to get that insurance benefit. So just like my car insurance, I have to pay my premium to have my car insurance. For my health insurance, I have to pay my premium. So same with SSDI, the way you're paying that premium, so to speak, is the taxes that come out of person's check when they're working. So if you've paid into the system and you've reached that disability insured status and are disabled according to the Social Security definition, and that definition is the same definition for SSI and SSDI. There's no difference in that definition of disability. So if I've reached that insured status, then I'm potentially eligible for that SSDI benefit. And it's an insurance benefit. It's not needs-based. So you'll notice maybe the difference is it didn't talk about an asset limit and it didn't talk about an income limit. It's based off of initial eligibility criteria. There is an income limit because you have to just show that you're unable to work, but it's not the needs-based program where other income is affected by it. And the average this year, and it can vary, just like the video said, that somebody who had lower wages over a period of time would get a lower amount in SSDI, and somebody who had larger wages over a period of time would be entitled to a higher SSDI payment. The video also mentioned that on the Social Security website, so if you go to the Social Security website, which is just ssa.gov, you can sign up for a My Social Security account, and I encourage you to do this if you haven't already, and encourage other folks to look into that as well too, because within that site, if you sign up for an account, it'll tell you if you've reached that disability insured status. It would give an estimate of the benefit amount. It also gives an estimate of a person's retirement amount, depending on what they want to do, early retirement or retirement at their full retirement age, or I think there's even a late retirement piece now. It shows a person's yearly earnings on there as well too. And then for individuals who are receiving a SSDI benefit or SSI benefit, They can get a benefit verification letter there. They can report earnings there. It'll show their yearly history of earnings as well too on there. So it's a great tool to find out if somebody potentially is eligible, has reached that insured status, or if they are receiving a benefit to get verification of that and report earnings. This benefit, just to differentiate, like we talked about on SSI, is never paid on the first of the month. Usually the third, but never on the first. So if somebody's getting a benefit on the first, we know it's SSI. It's paid any other day of the month, and it's not SSI. It's that SSDI benefit. And then Medicare comes with the SSDI benefit after a 24-month waiting period. And that 24-month waiting period is from the date of entitlement, so when somebody was first eligible for a cash benefit. So that might mean, I just talked about the scenario where somebody may have waited a year and a half to be approved for the benefit. So if I applied a year and a half ago and I was approved today, and Social Security says my date of disability was 2 years ago, and my date of entitlement, where I was first eligible for a cash payment, was a year and a half ago, that 24-month clock started when I was eligible for that first cash payment. So a lot of times when folks are actually approved for that SSDI benefit, they've served a portion of that waiting period already. And because this is not a needs-based benefit, it's a benefit that you had to earn. There is no asset limit. Any questions on the eligibility?
There were 2 questions that came through. The first one is, if a person has not paid enough into the system, do they receive SSI instead of SSDI?
Yes, potentially. So if they meet the eligibility criteria for SSI, then below the asset limit, below the income limit, then they potentially can be eligible for SSI. Usually when folks are applying for Social Security benefits, unless they know for 100% certain that they are eligible for SSDI and it's over the SSI federal benefit, full federal benefit rate for the year, most folks apply for both benefits. So that you might be denied for one and not the other, so you don't have to start that application process over. And it is possible, in addition, for somebody to be eligible for both SSI and SSD. So I think the video talked about a scenario where somebody was entitled to, off of their work record, a $500 payment in SSDI. So if the individual also meets the eligibility criteria for SSI, then they can receive SSI benefit up to that federal benefit rate. So if I'm getting $500 in SSDI, if I do that same calculation that we looked at under the SSI benefit, then that would make me eligible for, it would actually be $303 in SSI because they give you an extra $20. So it is possible for folks who are receiving an SSDI benefit that is below that federal benefit rate for SSI to get both of those. It also is possible for somebody who's not entitled currently to SSDI, who's receiving SSI, who's going to work, who's then paying taxes and paying into that SSDI bank to make themselves eligible for SSDI over time as well.
Okay, and the next question, I'm sorry, did I cut you off?
Nope, go ahead.
Okay. There was an additional question after this one as well. So why would someone who earns a lot in work wages have more SSDI payments?
So it's based off of the amount of your earnings and the amount of taxes that you've paid into the system. So like the video went into a little bit, somebody who had gross earnings over a time period of around $5,000 a year has paid less in taxes into that trust fund than somebody who earned $50,000 over the same time period. They've paid more in taxes. Proportionately, the amount of that is taken out in taxes is greater when the income is greater. So that's why there's that huge variance in the amount that a person is eligible for in an SSDI payment.
Okay, and the next question we had is, can one work and receive SSDI?
Absolutely. We're going to go to that next. Thank you for that prompt. So Absolutely, it's possible to receive SSDI and go to work. So our myths, if I work, I'm going to lose my SSDI. Not true, and I'll show you why. And then if work causes my SSDI to stop, then there's no way for me to get it back, or I'm going to have to go and reapply and go through that process that took me 1.5 years the first time. So not true.
Another question came in. Sorry to interrupt.
No.
Does a mental health diagnosis qualify a person for SSDI, or is it only physical disability?
It can be either or both. So Social Security puts out information, the listing of disability and the criteria for it. If you go to the Social Security website and you search for Blue Book, you'll find that listing, and it lists physical health conditions, mental health conditions, intellectual disabilities as well too, and it talks about specifically what the criteria is to meet that definition of disability. So whether it be physical, mental, or a combination of those things, it doesn't matter. And sometimes, just kind of a side note, when folks are in the application process, they might think, their primary diagnosis and reason that they need that disability benefit is, say, bipolar disorder, for instance. But they might also have some physical health conditions, and sometimes it's the crossover between more than one health condition that really shows how that functioning is impaired. So, for instance, if somebody, again, has diagnosed with bipolar disorder and is also diagnosed with diabetes, and their sugar levels are uncontrolled, that can also affect mood. So that in and of itself, maybe that diagnosis of diabetes isn't enough to meet the eligibility criteria, but because one can kind of drive the other, sometimes it's the intersection between those. So in the application process, I really encourage folks to list all physical and mental health conditions, even if they think one is kind of the primary reason, because sometimes it's in those intersections between the diagnoses that helps paint that full picture of what it's like to be that individual and what is making it difficult for them to be able to work. Any other questions?
Not seeing any in the chat right now.
Alrighty, so we'll get back to that question about work. I'm going to show you a quick little video on the SSDI work incentives and how it's possible for somebody to work with SSDI.
SSDI Work Incentives, a Griffin Hammis production tailored for Michigan.
I just got offered a job making $1,300 a month, but I haven't worked since I got SSDI, so I'm wondering what happens if I take the job.
Well, that's an exciting opportunity. With SSDI, there are 3 phases of work incentives. The first phase is called the trial work period. During this phase, you can earn as much as you want and still get your SSDI.
Oh, wow, that's great. How does it work?
When you're found eligible for SSDI, you're given 9 trial work months. If you earn above the trial work level, you'll use up one of those months. In 2020, the trial work level is $910 a month, but it usually goes up in January of each year. If you haven't worked since your SSDI began, you'll likely have all 9 trial work months available. So if you earn $1,300 a month, for 9 months, you'd get your SSDI and wages.
That sounds great. What happens after the 9 months?
After you finish your 9th trial work month, you enter Phase 2. Phase 2 is called the Extended Period of Eligibility, and this phase lasts 3 years. During this phase, Social Security checks to see if the work you do is above or below something called Substantial Gainful Activity, or SGA for short. In 2020, SGA is $1,260 a month, or $2,110 a month for people with blindness. In months your work is below SGA, you get your SSDI. In months your work is above SGA, the SSDI pauses and you don't get it that month. What most people don't know is that included in this phase is a great safety net. You keep SSDI eligibility status even if you go above SGA, and that means you can get it quickly restarted. Now, some people plan to get a job that pays more than their SSDI, so they're okay with it stopping. Other people can't do that right now, so their plan is to keep getting SSDI while they work. You're the one that gets to decide what makes the most sense for you.
I'm glad to know I can choose. So if I earn $1,300, does that mean my SSDI will stop in phase 2?
Well, since your gross wages would be above SGA, that's possible. But if your countable wages fall below SGA, then you'd still get the SSDI.
Oh, what are countable wages?
So countable wages are the amount that's left over after subtracting work incentives like impairment-related work expenses and subsidy. Let me explain. Impairment-related work expenses, called IRWI for short, are medical-type expenses that you pay for that make it possible for you to work. Subsidy is the amount of extra help you get or less work you do on the job because of your disability.
Oh, okay. So how would all that apply to me?
That's a great question. Let's look at an example. Let's say each month you spend $100 on medications that you need to be able to work. Plus, let's say you get $200 worth of free help from your coworkers to do your job. After subtracting those from your gross wages, you end up with $1,000 in countable wages. And that is below SGA, which means you'd likely still receive your SSDI.
Great, I got it. So if I do end up earning above SGA, it's good to know I can easily get it back. So what happens in phase 3?
In the third phase, Social Security will still check to see if your countable wages are above or below SGA. If they're below SGA, your SSDI simply continues. If they go above SGA, then your SSDI would stop completely. To get it back, you'd need to do a new application, or if you meet the criteria, you can ask for something called Expedited Reinstatement, which is another safety net. Expedited Reinstatement gives you up to 6 months of SSDI, while Social Security checks to see if you're eligible for benefits again.
All right, I think I got it. It's great to know I have safety nets to support me as I return to work.
You can learn even more about SSDI and work on mi.db101.org. Read the SSDI and work article. Use the Benefits and Work Calculator to see how you can be better off with a job. And if you'd like to speak to someone about SSDI and work, call Social Security's Ticket to Work helpline at 1-866-968-7842. Their TTY number is 1-866-833-2967. To see more videos like this one, go to mi.db101.org/video/benefits. Knowledge is power. Take time to learn more about SSDI and work.
Alrighty, so from the video, we know that it's a little bit more complicated than an SSI. So the SSI was a straight calculation on how that benefit is affected, where SSDI benefit goes through those 3 phases. So as long as an individual is creating a plan and working with a benefit to work coach or a benefit planner, so that they understand all of this, it's possible to work and get ahead, maintain that SSDI benefit, maintain Medicare. And the general rule around working with that SSDI benefit, if earnings are below SGA, which again this year is $1,260 for individuals and $2,110 for individuals who have blindness that meets the Social Security definition of blindness. So general rule is individuals' earnings, gross earnings are below that SSDI benefit continues. If they're above that, then that SSDI benefit after the trial work period would pause. And I'll go into those phases in just a minute a little bit more for you. Just to do another example, if I had $720 in earnings a month and my SSDI benefit was $925, My earnings are well below that SGA amount, so I would keep my SSDI benefit and my total earnings would be $1,645. So that myth is not true of if I work, I will lose my SSDI. We know it's totally possible to work. Was there any questions before I go on to the phases a little bit more?
Yes, there was one question. I heard from someone that the more disabilities you have, then your SSDI increases. Is this true?
No, it's really just related on the SSDI to how much you've paid into that Social Security trust fund. So the amount that you've worked and paid into taxes dictates the amount that you would be eligible for in that SSDI benefit. So regardless if you could have one medical condition or 20 medical conditions, it's based off of the amount paid into the trust fund. Alrighty. So when there was an email that went out giving you the link to this training, and included that was some handouts. This handout is within that packet as well too, so you should have access to that. If you don't and want to email to you, again, just type that in the chat and we'll make sure that that gets to you. But this breaks down those phases a little bit more. So the video talked about the first phase, when somebody starts working with an SSDI benefit, and that's called the trial work period. And the trial work period is really like it sounds. It's really giving the person an opportunity to test out working to the best of their ability with no penalty to their SSDI or Medicare benefit whatsoever. So how it works is individuals are given 9 trial work period months. It counts as one of the trial work period months if the amount of their earnings is above the trial work period threshold for that year. And this year that amount is $910. And whenever I'm explaining this to folks, I inevitably get the question then, so I can't earn more than $910 then. And that's not the case at all. It's really, that's just the number that Social Security uses as to whether it counts as one of those 9 months. You know, so if I'm earning $900, I'm keeping my SSDI benefit and I did not use a trial work period month. If I earned $9,000, I'm keeping my SSDI benefit and I used 1 trial work period month. So there's no limit on earnings during the trial work period, okay? It's just that number is whether it counts as one of those 9 months, okay? So if somebody uses all 9 trial work period months, and it has to be within a 5-year kind of rolling window. So if I worked 6 years ago and I used 5 trial work period months, and 6 years later, those 5 have dropped off if I never had any in between. So when Social Security is looking to see if somebody has used all 9, they start from today and they look back 5 years. Was there 9 months within that 5-year period where earnings were above that threshold for the year? So if somebody uses all 9 of those months, then they go into that phase 2, which is the extended period of eligibility. And that lasts for 3 years, 36 months, and it is consecutive. And it starts the month immediately after you use the last trial work period month. So if I used my last trial work period month in May of this year, then June would be my first month of the extended period of eligibility, and that's going to go through May of 2023. Okay, so it's 3-year periods consecutive. And what they're looking at during the extended period of eligibility is that SGA, or substantial gainful activity. Are countable earnings above or below that mark? So if an individual is earning, gross earnings are below SGA, then that SSDI benefit continues. If an individual chooses to work and have earnings above that SGA amount, then the benefit's going to pause. It's not terminate, it's pause during that 3-year period. So what that means is if I'm working, I'm earning $1,000 a month, and then I say things are going great, I'm going to work full time, I'm going to earn $2,000 a month. I know that that makes financial sense for me to do. I understand my SSDI benefit's going to pause, but I'm okay with that. And then a year down the road, I'm still in that 3-year extended period of eligibility. I'm not able to sustain working at the full-time level, and my earnings drop back below SGA. I just contact Social Security. I say my earnings dropped. They start my SSDI payment back up. Okay. So I always kind of compare it to, it's like that 3-year period you're on payroll. It's whether or not you're entitled to a payment based off of your earnings. And like the video talked about a little bit too, it's really important for folks who are, when they're considering working above that SGA amount, to make sure it makes financial sense, to work with a benefits to work coach or a benefits planner, which I'm going to talk about how you can access either one of those two groups of people towards the end of this, but so they can make a plan. So if somebody's getting $1,500 in SSDI every month, and their plan to go to work is to earn $1,300 in gross earnings, it doesn't make sense, financial sense, for them to earn $1,300 and have that $1,500 stop. Okay, but if they're planning on earning $3,000, it might make sense then financially to have that SSDI benefit stop. So we want to make sure that folks have a full understanding of the financial implications and can make their decisions based off of the reality of it. So working with a coach or a benefits planner is really going to help folks in that criteria. Like the video talked about a little bit too, down here in this third box, that it's countable earnings. So potentially somebody could be earning above SGA, but if they're paying for things out of pocket that they need to be able to work, if they're maybe getting some extra support on the job or have a job coach, those things can be deducted from their countable earnings and potentially put them below that SGA mark. Again, want to be connected with somebody who can help them navigate that. And then phase 3, the difference there, we just call it the post-extended period of eligibility. That begins after the 3 years of the extended period of eligibility ends. And the difference there is that's the first opportunity for that SSDI benefit to be terminated. So if somebody is below SGA, continuing to receive that SSDI benefit, that 3-year period of the extended period of eligibility is over. They're still working below SGA. 5 years later, that SSDI benefit is going to continue indefinitely. So there is no end date if somebody is working below SGA. Difference is in that phase 3 or post EPE is if somebody works above the SGA, at that point, benefits would be terminated instead of pause. Okay, so that's the difference. And I always tell people who've never worked and are considering working, that's at least bare minimum 3 years, 9 months down the road. Okay, so life, if you're able to work and sustain working at that level, life's going to look a lot different for you at that point when we have to make that decision, if that makes sense. And then, like the video talked about as well, too, there's that provision of the expedited reinstatement of benefits. So even if somebody's benefits are terminated related to work, that doesn't mean that they were found medically improved according to Social Security. Okay, it just means that their benefits were terminated because their earnings were above SGA and they were outside of that 3-year window. So they qualify for that 5-year expedited reinstatement window. So there's a 5-year window from when benefits are terminated, that if an individual is unable to perform SGA level earnings, they can apply for expedited reinstatement. Social Security is going to pay them benefits while they're doing what's called a medical review, so they don't have to be found disabled again. It's a different standard. They're checking to see if there's been medical improvement. While they're making that decision, person is receiving the SSDI benefit. If individual is found to be not medically improved, benefit would continue then indefinitely. If individual is found to be medically improved, then they would not be eligible for the SSDI benefit to continue, but they also wouldn't have to pay back those provisional benefits. So it's a really nice safety net for folks to be able to, even if they get to the point where they're okay with that benefit being terminated, there's still that 5-year window at that last level of protection to get benefits back real quickly if needed. Is there a question?
There was one that came through. What is IRWE?
IRWE. So IRWE, or IRWE, stands for Impairment Related Work Expense. And that is something that an individual needs to be able to work, that they're paying for out of pocket. It's related to their disability or a health condition, and it's a reasonable expense. So like the video said, if you're paying out of pocket for prescription costs, and that's pretty much an automatic IRWI under Social Security terms. So that means if I'm paying $50 a month in prescription copays, that would count as an impairment-related work expense and potentially reduce my countable earnings. So under the SSDI provision, Social Security is only going to look at whether a person has IRWIs if their earnings are above SGA. So if somebody's earning $1,000 a month, they're below SGA, there's no need to look at those IRWIs. Somebody's earning $1,400 a month, they're above SGA. We want to take into consideration whether the person has IRWIs at that point or not. Also, side note, I didn't go into this with the SSI portion, but there is also that same work incentive under the SSI provision. It's exactly the same. It has to be needed to be able to work related to their disability or a health condition, a reasonable expense, and something they're paying out of pocket for. And that can be put into that formula that we looked at under the SSI benefit and reduce their countable earnings. And that's under the SSI provision, regardless of the person's earnings, you can apply IRWIs all the time under SSI. Hopefully that clarified it a little bit, but it gets real weedy, and today is meant to be kind of a real broad overview of how all this comes together. But then if you're going through this yourself, to get you connected with a benefits to work coach or a benefits planner who can look at your specific situation and help you navigate this. And benefits coaches and benefit planners are not meant to be, here's the information one time, you're on your own, good luck. That's not how that relationship works. It's meant to be an ongoing relationship to help you navigate all of these work incentives and help you feel empowered by having the information and knowledge and make choices around that instead of like, oh gosh, I didn't know that was going to happen. Okay. Really broad overview. And then just the last thing I want to point out on this slide is this little box here towards the bottom that's a continuation of Medicare. So Medicare stays in place as long as a person continues to receive the SSDI benefit. It will stay in place indefinitely. If a person SSDI benefit is paused or terminated, Medicare will continue for at a minimum 93 months after the last trial work period month, and that's 7 years, 9 months. So Medicare's not going anywhere either, not going away by work either. So Medicare is definitely staying in place when an individual goes to work. So there's no concern about that about that Medicare benefit ending. And then I kind of jumped ahead and covered this one, but our myth was if work causes SSDI to stop, there's no way to get it back. We know that the reality now is that you can keep your SSDI eligibility status or get that benefit reinstated even if you earn so much that you weren't eligible for a check. And the two provisions that allow that is that phase 2, if you're in that one, that extended period of eligibility, or that phase 3, if benefits were terminated, you have that 5-year window to qualify for expedited reinstatement. Any questions on any of the SSDI stuff? I know that's a lot of information and it gets a little bit more weedy than the SSI portion.
I had a question.
Go ahead.
For the IRWI, would transportation expenses count?
Potentially. So with transportation expenses, an IRWI has to be something that's related to the individual's disability. So transportation expenses can get a little bit tricky under that provision. Everybody, except in our times right now where a lot of us are working from home, needs a way to be able to get to work. So that's normal. That's not disability related for for an individual to need a way to get to work in most cases. So, however, where the difference could be is I worked with a woman who we were able to get the IRWI approved for transportation because if she had a anxiety disorder where if she were to take public transportation, well, first of all, she also had a physical health condition. So if the nearest bus stop was a half a mile walk away, so she wasn't physically able to do that. And then even if she was able to do that, due to the anxiety condition, by the riding on the bus would have caused that condition to be exacerbated. And by the time she would have gotten to work, she basically would have needed to go home because she wouldn't have been in a condition to be able to work. So if it's related to the ability to work in some capacity, then it can count as an IRWI. But just general, everybody needs a way to get to work. But if it's related to specific, something related to their disability or health condition, then it potentially can be counted. Did that help clarify?
Yes, thank you. Yes.
Good. Folks have other questions on SSD?
Also, I was wondering how you start the 1619B.
So that's under SSI, so it's an automatic work incentive, so there's nothing that the individual needs to do for that to go into place. So if I'm receiving SSI and I'm earning so much that my SSI check goes to 0, then you're automatically put in that 1619B status. With SSI, when individuals are working, they do have to report their earnings every month to Social Security, and that can be done in a variety of different ways by either physically getting the pay stubs there or using a telephone reporting system, or there's an app for the smartphone to report it that way. So as long as a person is reporting their income, and then if that if their SSI check zeroes out, then they automatically go into that 1619B status. And then when they're working and in that 1619B status, as long as they're still reporting their earnings every month, if the earnings drop, that's what's going to start that SSI payment back up again, because Social Security is going to have that regular record of earnings to be able to change the amount of the check or reinstate the check based off of the individual's earnings. Other questions?
Not seeing any in the chat.
Okay. Covered that. So I'm going to jump into Freedom to Work Medicaid, and I know there was a question early on about this. So I'm just going to talk about the general eligibility criteria for this to begin with. Generally, where we see an individual who's eligible for Freedom to Work is not somebody who's receiving SSI, because we know under that 1619B provision, an individual can earn up to $36,887 this year and still keep Medicaid. Now, if they earn above that, then they could look at this Freedom to Work Medicaid category. So usually we're looking at this Freedom to Work Medicaid category for individuals who are receiving the SSDI benefit. So they have to be disabled according to the Social Security standard. There is an age requirement with this one, so they have to be between age 16 and 64. So if an individual is over 65 or older, they wouldn't qualify for Freedom to Work Medicaid. And then the initial eligibility criteria for this is income below, countable income below 250% of the federal poverty level, and this year that's $2,658 a month. And countable income covers is counted the same way that they look at that SSI income. So the first $20 off of the unearned income doesn't count, and then a little less than half of the earnings only count as countable income. So my example here, which might help clarify it a little bit, if I'm receiving $1,400 in SSDI, then Social Security for countable income takes that $1,400 and subtracts the 20, so 1,380 of it is countable. And then if I had gross earnings of $1,000 a month, then we're applying that, minusing that $65 earned income disregard and dividing by 2. So out of the $1,000 of earnings, the only countable portion of it is $467. So you just add up those two, the unearned countable and the earned, and the total countable income in this scenario is $1,847. So that's well below that $2,658 income limit. And then there is an asset limit of that, and this year the asset limit is $7,860. So as long as an individual has assets below $7,860, that's money in the bank, money in retirement, savings, investments, not first house, not first car, not possessions, then they would qualify for Freedom to Work Medicaid. And then down here's this little provision that the ongoing eligibility changes a little bit. So once you are found initially eligible, so I just talked about application or initial eligibility, this is the criteria, but continuing eligibility, once I'm found eligible for it, then they're just looking at your countable unearned income has to be below 250% of the federal poverty level. So that means that there's no limit on earnings once you're found eligible for Freedom to Work. So you can earn as much as you want and still maintain access to Medicaid benefits. Same with the assets. Again, I said the initial asset limit at the time of application is $7,860. But once you are found eligible for it, then that asset limit is up to $75,000. So this is the only Medicaid category that allows individuals to actually save money while working. So many times, especially under SSI and Medicaid rules, there's a $2,000 asset limit for SSI. There's a $2,000 asset limit for most Medicaid categories. So if somebody's earning and trying to get themselves out of, a situation of poverty, and they're earning so much, then they have to make sure that $2,000 is that their assets are below $2,000 instead of encouraging them to save money. This program allows people to save money and put it away and encourages, saving for retirement or later days or rainy day funds, which is huge. And then the monthly premium, which somebody asked about earlier, potentially there is a monthly premium to stay in this program. So if earnings are below 138% of the federal poverty level, which is $1,467 a month this year, and that's just total income, no deductions, then there would not be a premium. If it's above that mark and below $75,000, then there's a premium of 2.5% of total income. So just to give an example of somebody who had $1,400 in SSDI, $1,000 in earnings, total income is $2,400, and that premium would be $60 a month. And what that $60 a month does is basically between Medicare and Medicaid coverage, you have no co-pays, no co-insurance for any services. It keeps a person in the Medicare program that's called the Extra Help or Low Income Subsidy for their prescriptions. So it keeps their prescription co-pays low. So they would never have to pay more than $3.90 for a prescription, never have to pay a premium or deductible for their prescriptions. So that $60 a month basically keeps them in 100% medical coverage. And generally, again, once we get somebody connected with a benefit to work coach or benefit planner, we're going to look at all of these provisions all together. So sometimes folks say, well, I have to pay $60 more a month. I'm not getting ahead financially. Most of the time, individuals still come out way ahead financially. Once in a while, I find somebody kind of right on the edge where, if you worked a couple hours more or a couple hours less, it makes all the difference. But most of the time, even with that, having to pay that premium, you're still coming out way ahead financially, and working with the benefit to work coach or a planner is going to help you see that, and they'd be able to show you some side-by-side comparisons. And to apply for that, that's a DHHS program. So if you are already receiving a Medicaid benefit, you just need to report the change that you're working, and then they'll assess your eligibility for that, for the Freedom to Work Medicaid criteria. If you are not working, then you would need to do a new application. That can either be done online or by phone at this point in time. Another great provision of this is if somebody is on a Medicaid spend down and not working. So a Medicaid spend down is a monthly recurring deductible. So a person has to incur a certain amount in medical expenses every month before Medicaid would kick in. Under Freedom to Work, if that individual starts working, they can actually get off of that spend down and get on Freedom to Work and reduce their medical expenses and have full Medicaid benefits. So I've seen a number of people who maybe were kind of contemplating work before and then became aware of this Freedom to Work Medicaid, and it actually was a huge incentive for them to start working, and it's a huge bonus on so many levels, you know. So they're increasing their income overall. They've decreased their medical expenses because they have full Medicaid benefits now. They're getting all the benefits of working, you know, all the great benefits that come with working on top of that. So it's really kind of improved an individual's quality of life. So I get a little excited about this Medicaid category because it's really kind of a game changer in helping individuals work and sustain working, and a huge incentive to keep that medical coverage in place. Questions on Freedom to Work?
Looks like Cheryl had a comment. I didn't know you can earn as much as you want under this program.
Yep. Yeah.
And I just wanted to, Cheryl, was your question answered from before regarding the premium monthly?
Maybe she's typing it in there, but yeah. Cheryl, if you haven't worked with a benefit to work coach or planner, I'm going to talk about that next, but I would really encourage you to work with one of those folks so that they can show you kind of side by side and help you look at the big picture and whether that makes financial sense. Even though you're paying that premium, you know, are you still coming out ahead financially, and does it work for you?
I had a question about the Unable account.
Yeah.
About that at all?
Yeah. Go ahead.
That's different than this Freedom to Work then? My understanding is they can accumulate money and not be penalized. My son's on SSI, and he's never worked. He's trying to start working, and I didn't know much about this ABLE account because he'd eventually like to possibly live independently, and he was thinking that saving some money could help with that.
Absolutely. So ABLE accounts are, and I'm going to bring up a little window on that. ABLE account stands for Achieving a Better Life Experience, and they are similar to a college savings program and how they're structured. One second. I can't click on these buttons and talk at the same time. So here we go. All right. So ABLE accounts, Achieving a Better Life Experience, are accounts that are excluded assets for SSI benefits and Medicaid benefits. For an individual to be eligible for an ABLE account, their date of disability onset had to have occurred prior to age 26. And they have to be disabled either receiving a Social Security disability benefit, or folks can self-attest that they meet that definition of disability. So you don't have to be under age 26 to open an ABLE account. So for instance, you know, say I was 35, you know, maybe a few years ago I was, and I became disabled when I was age 22. I can open an ABLE account today because my date of disability onset was prior to age 26. So individuals can put money in ABLE accounts. This is on the Disability Benefits 101 site as well too, and right on the main page there's a article on ABLE accounts to give you more information on it. You're allowed to put up to $15,000 in the account a year coming from any source, and then if an individual is working, they can contribute up to another $12,490. So for SSI purposes, the first $100,000 in an ABLE account is excluded as an asset. So right now under SSI rules, an individual to be eligible for that SSI benefit has to have assets below $2,000. So if they open an ABLE account and start putting money into that, and that goes above the $2,000, that isn't counted in the eligibility criteria for SSI. So it's a great way for folks to be able to set aside money, save money in another account and not have it affect their eligibility for SSI. And then it's also not counted as an asset up to any amount for eligibility for any Medicaid program, for food assistance programs. This FIP is Family Independence Program, which is a cash benefit through Department of Health and Human Services. So it doesn't count as an asset. And then funds in those accounts can be used, what they call is any disability related expense. And there's a very broad definition of what they consider a disability related expense. So it can be housing, it can be utilities, it can be education, it can be transportation, it can be medical co-pays. Basically anything a person needs to be able to use to live. So there's a very broad definition on how those funds can be utilized. You can use it for food, to go to the grocery store as well too. It can't, a little bit weedy if you are using it to take a vacation, could be justified. If you're using it for, if you go to the casino, not really a disability related expense. So still has to be related in some capacity to kind of maintaining and enhancing their quality of life. So things that are kind of on the edge of that are a little bit iffy, but a very broad definition. And funds can be accessed either through a debit card. In Michigan, they can issue a debit card so individuals can use it just like they would any other debit card to purchase things and pay for things. Or you can request through the ABLE account for them to either pay things directly to whoever you're paying, or for reimbursements if you submit receipts. So it's a great program. So do you have any other questions on ABLE accounts?
Yeah. How soon would he be able to open one, and how would we go about doing that?
So there in Michigan, let me pull that up. Has an ABLE account. You do not have to enroll in Michigan's ABLE account. You can choose, I don't remember how many there are across the United States, but you could choose to open an ABLE account in Ohio's if you'd like. Just to show you an example though, this is Michigan's ABLE account. You're able to set it up online. Just go to login, create an account. I believe there's an initial deposit limit of $20, so you don't have to have an exorbitant amount of money to open an ABLE account, and you're able to open it up in 15 minutes online and make that initial deposit by transferring money from another bank account into that account, or you could send a check in, either way. But it's a very simple process. It doesn't require an attorney or a financial expert to do it. You're able to do it very similarly to how you would set up a bank account online. And then
so I access that through the SSI website.
So in Michigan, the website for the ABLE account is MIABLE or myable.org. And then there's also an ABLE National Resource Center that gives a lot of great information about ABLE accounts in general. And it also would show you all of the ABLE accounts that are available nationwide and show you some of the differences between them as well too. And that website is ablenrc.org.
Okay, because I just noticed he got a stimulus check this month, and would I be able to take that out and start this ABLE account?
Absolutely. Yep.
All right, perfect. Thank you.
Yeah. And side note, I've had lots of questions on those stimulus checks. They have no effect on benefits of any kind whatsoever, and they're excluded as assets for a year. So if you had $1,999 in his bank account prior to the stimulus check, and that put him over the $2,000 mark, it doesn't count as an asset for a year. And it doesn't reduce the amount of the SSI benefit whatsoever, so it has no effect on benefits.
Oh, thank goodness!
Yeah.
I was panic over that.
Yeah. So you got a year to figure out what to do with it. Putting it in an ABLE account is an awesome choice to put it away and be able to save it instead of worrying about what you're gonna spend it on excess funds. So an ABLE account is a great thing to do with that.
Perfect.
And on this Disability Benefits 101 site as well too, main site, right here on the main page is the ABLE accounts, and that will also link you to Michigan's ABLE account and the National Resource Center as well. Any other questions?
Yeah, we had a couple questions come in. So the first being, one must apply for freedom to work, and it doesn't cover all Medicaid recipients.
So for freedom to work, if you are already receiving a Medicaid benefit, you just need to report to Social Security the change that you started working, and they would assess you for eligibility for freedom to work. If you're not already receiving a Medicaid benefit, then you have to apply. And in order to apply, you need to go through DHHS. Let me pull back up that slide. So that does require some action to be able to get you over to that Medicaid category. So either reporting the change that you started working or doing a new application, and of course reporting that you're working on that application. Is there others?
Yes, there was one other. Would this also apply for copay counseling costs as well?
Were we talking about the ABLE account? Oops. Guessing that's probably related to the ABLE account. Yeah, any medical expenses, you can use funds in the ABLE account to pay for those medical expenses. And if that wasn't the right question, whoever had that question, feel free to unmute yourself and clarify what you were asking for me. Alrighty, move on. So now that I gave you all this information and you want to know the details of your situation or person you're working with or your family member, where do you go to get additional assistance? So if you are connected with an agency within OCHN's network, you want to check to see if that agency has a benefit to work coach or a benefit planner on staff. We're starting to see an increase across the network of some agencies having that benefit to work coach or benefit planner on staff. So check with case manager, sports coordinator, whoever your individual primary point person is within that agency, and to see if they have somebody on staff that can help you. If not, if you are working with Michigan Rehab Services, included with that is they are charged with providing benefit planning services. So if you're working with Michigan Rehabilitation, then ask your worker through them, let them know that you want benefits planning, and they will get you connected with the benefits planner. And if you are working or actively looking for work, Social Security funds programs called Work Incentive Planning and Assistance Programs, or WIPA programs. For this area in Oakland County, United Cerebral Palsy of Metro Detroit is the agency that houses that WIPA program for that area, and I put the number up on the screen on how you would connect with them. And then for general information, if you're maybe not ready to work yet, but you are thinking about it and want to just kind of get an idea of how your benefits would be affected, you can call the Social Security Ticket to Work helpline. They would be able to look up what benefits you are receiving and give you some general advisements over the phone. But for folks who are working or actively job searching or about to begin that process, we really want you to get connected with either through agency that you're connected with the benefit to work coach or planner, or through the WIPA programs. And I also put up here some links to other resources that we talked about. So the Michigan Disability Benefits 101 planning website, link to that, Social Security website, that Social Security, my Social Security account is up there. I mentioned the blue book earlier. Social Security has unique names. So there's a blue book and there's also a red book, and the red book is all about work incentives. So you'll find lots of information if you go to that. Social Security also puts out has a work site that a lot of information related to working. It covers the work incentives, and then other topics as well related to individuals with disabilities who are considering working. And then to be able to look up, if you're outside of Oakland County, who the WIPA program is for any area within Michigan. There's a link there to the Michigan Work Incentive Planning and Assistance Program. So you would just click in what county you're looking for assistance, and it'll show you what WIPA program covers that county and give you their phone numbers so you can get connected with them. And I see Cheryl meant for IRWIs. Yes. So yeah, that would also count for copays, for counseling. They would count as an IRWI as well too, as long as you're paying out of pocket for that and it's a reasonable expense. It would potentially count as an IRWI. Folks have other questions? And feel free to unmute yourself. Got a thumbs up. Thanks, Cheryl. You can see the chat now. So hopefully this was helpful. On the very first page of this slide, and this is in your email box as well too, you have a copy of all the slides. This is my email address. If you have questions and having trouble navigating the system in any capacity, feel free to reach out to me. I may not be able to provide that individualized counseling to you, but I certainly want to make sure that you get connected with somebody who can help you. Within Training and Treatment Innovations, within our Oxford and Troy office, I provide that service. We also have another benefit to work coach within TTI, and we have one with our clubhouse as well too. I know Easter Seals now has a couple benefit to work coaches as well too on staff, so they're both great and trained and very good resources for folks receiving there. I actually think Jennifer is or was online through CLS. She's also a great resource for folks connected with them as well too, because I know she's been through training that I did and knows her stuff pretty well as well too. So there's lots of great resources out there. I just really encourage folks who are working or considering work to get connected with somebody who can help them navigate through this. You know, my goal when I'm working with folks is to always make sure that benefits are not the reason that a person is choosing not to work, because it's totally possible to work, get ahead financially, keep your Social Security benefit or access to that benefit, and keep your health insurance and reap all the great benefits of working as well too. I appreciate all of you attended today, and if there's anything I can do for any of you in the future, feel free to reach out. And I think Tricia put up a link to complete an evaluation. If you wouldn't mind taking a couple minutes to do that, we'd greatly appreciate it, because myself and OCHN is always looking for ways that we can improve what's being provided to folks. If there's any last minute questions, I'll stay on for a couple more minutes and happy to field those.
Yeah, so it looks like Cheryl said a great webinar and she's learned so much today. I have as well, so I appreciate this training, Tracy, and I appreciate everyone that's taken part in it. I hope that you guys all thought this information was plentiful and relevant, and all of these resources will be helpful to everyone. Thank you again, Tracy.
Welcome, anytime.
Yes, thank you, Tracy. I just want to reiterate, I did link the training evaluation. So if you enjoyed this webinar and want to see us bring in other kinds of webinars or more like this, please fill out that evaluation. I do read those. I also put a link in the chat if you'd like to receive a certificate of attendance. So there's no continuing education credits with this, but I do get requests a lot for a certificate of attendance. So there is a link for that, and you should receive that within a week. This recording will be available within a week on our website under training and under provider trainings and community training.
Thanks, Tricia.